Okay.
Welcome to Get Momentum for Life. I'm your host, Dr. Eric Pugliese, and today we'll be discussing the subject of food addiction. Food addiction is a controversial diagnosis. Not many clinicians fully recognize it as such, and the book of psychiatric diagnosis, the CM5, doesn't have it in their text yet. Today I'll be interviewing a world-renowned expert in addiction medicine, and in particular in food addiction, Dr. Vera Tarman. She's from Toronto, Canada, and she does a number of things. So to begin with, she's written the book Food Junkies, Recovery from Food Addiction. She co-hosts a food addiction podcast. She runs workshops, and she's got time to treat food addicts, and she does it with passion. She has been a food addict herself, and her main goal is to help those who suffer from food addiction. Hi, Vera. Thank you for granting me this interview.
Hi. Oh, thank you for all the way from us to Australia. I'm delighted to speak with you. Thank you.
My pleasure. Tell us a bit about yourself. Who is Vera Tarman? How did you become one of the biggest advocates for food addiction?
Well, okay. I don't want to spend too much time on that, but my interest in food addiction, sort of the engine that drives my passion, is that I have my own history of struggle with eating and weight, and I'm by no means unusual. I think this is probably the common affliction of most young people, especially women. And in the 1970s, when I was in university, like probably everybody on my floor, in the university floor, worried that I was too big. And now when I look at pictures, I think, what was I thinking? Like, it was really not that bad. I wasn't somebody who came from what we say big numbers, but I was very, very concerned about my weight. And I had already, like many of us in our teen years, encountered and embraced the sort of drinking culture. And by the time I got to university, I couldn't live that lifestyle anymore. So I came to the plate, as it were, with a family history of alcoholism, and I think a predisposition, or I could say that I am an alcoholic, and that was starting, but I stopped that. So I kind of came to the world of overeating already with the sort of plate stacked against me, as it were. Yeah. So I wanted to lose weight, and I had no other venue. I just thought I'm going to stop eating food and stop eating. Like so many young people.
Yes.
Yes, it wasn't like I'm just going to lose a little bit. It was like an all or nothing thing. And so I decided I was going to severely restrict so that I could lose weight quickly. At the same time, I was going to do all sorts of other self-improvement. I'm in my 20s. And what I found, maybe because of my predisposition, or maybe just because I'm a food addict, what I found is that I was able to restrict. I lost a great deal of weight quite quickly, like within 6 months, basically to the point where I was edging into what we would now call anorexia. Those terms didn't really, they existed, but they were not sort of part of the clinical world regular at that time. And I got really thin, and I got, all sorts of complications. And I thought, I have to stop this, just like I had to stop the alcohol. I have to stop this behavior. And so then I thought, okay, I'll stop. This is enough. I've lost the weight I wanted to, and more, definitely more. But what I found then, and here's the thing that just puzzled me, is that I couldn't just stop. When I stopped, all of a sudden, I was hungry. I had this voracious hunger. And so I thought, okay, I'll eat. But I couldn't stop eating. And even when I had to stop eating, I couldn't stop thinking about food. So then I morphed into what we would call bulimia, where I thought, well, if I'm going to eat, then I'll at least work it off, or even I learned to throw it up. And so exactly. So I developed basically bulimic behavior, but it compensated for my weight, so that I certainly gained weight, but not a terrible amount of weight. But the obsession of the thought, thinking obsession, it was either how much can I eat And if I do, how much do I have to run, or how much do I have to throw up, or how much do I have to restrict? Like I won't eat for 3 days. I mean, it was like my mind was not quiet. And within a year, it felt like a hornet's nest in my head. And I just kept thinking, how did that happen? This was like this altered state of mind that I had walked into that it just didn't make sense to me. So I then decided that's not going to work for me either. I of course, did a number of things that we did in the 70s. I went overseas. I didn't get as far as Australia, but the big thing, at least in US, Canada, was go to India. So I went to India, I went to England, and I thought that's going to help me because I'm going to be so busy dealing with, hotels and buses and all this that I don't have time to eat. But that didn't happen. What ended up happening was I would get a room, a student lodge somewhere, and just buy food and eat. And so I finally said, okay, then just eat. And then I just ballooned out. And then I guess I had what we would call binge eating disorder. Anyway, see, I told you this is going to be longer than you meant.
And that's completely fine, because that's a pathway of most food addicts.
Yes, exactly. That's exactly what it is. So anyway, then I finally figured out how I could control that behavior by, I just accepted this is what I'm going to do. I'm going to overeat and I'm going to throw up. There was none of this. I'll just have a little bit. I just knew that wouldn't work for me. And so I found a way. I smoked cigarettes. I smoked pot. I drank. I did a little bit of everything, and that somehow managed me. And then I became a doctor, getting bigger and bigger and bigger. And I think it was at some point in my 40s that I said, I'm telling my patients who are, high blood pressure, diabetes, you got to lose weight. And there I am. I reached basically 100 pounds more than I am now. And I just felt like I couldn't keep telling people that. So I got, around that time, I was working in HIV care and family medicine, and then I got into addiction care. And one night, the penny dropped that I thought, when I have the least hornets in my head is when I don't eat particular foods like junk food, like cake and stuff. Because there were times when I would restrict and stop eating, and I found that I didn't want that food, although I was starving all the time. So I'm just going to treat this like an addiction. And this was not yet when that was in any way discussed at all. But it worked. And so I would do a couple of months or a year or something of just eating no sugar. I would still eat flour and grains. And I just constantly was aware that hornet's nest went from buzzing and stinging to, just a few swats here and there, but manageable. And it wasn't until, it took this long, 2008, when I read the first article by Nora Volkow in the the American Journal of Addiction Medicine, where she talked about food as addiction. And it dropped I guess it's like people now say when they read my book or they find some book now that's out. There was nothing but that article, and I just dropped it and I said, there is proof. It's not just me. There is proof. And then I got on my sort of engine to promote this. So I then decided I'm going to maintain that this is an addiction, and I've maintained my sugar sobriety. I don't know if it was since then. That was 2008. Probably not that long. I probably had a few trials where I thought, come on, you can have a bit. But anyway, I realized that the sugar was a real issue. And then about 10 years ago, as keto was not a big thing then. Yes, Atkins was, but not really keto. Low carb, not really in my radar. I was more focused that sugar is the problem. But then I discovered that some people were talking about flour and refined carbohydrates as being a problem. And I thought, okay, I'm going to get rid of those too. Lost even more weight. And whatever noise, like it was like a 12 out of 10 before those hornets, it went down to maybe a 7 or a 6 with no sugar, but it was still there. When I got rid of the flour, it was down to a 3 or maybe a 3.5. And then about 7 years ago, I stumbled into another sort of way of thinking. It's actually a 12-step program that I belong to, where they said no grains, which is actually very keto now. No sugar, no flour, no grains. And that took that 3 out of 10 down to I'd say probably a 1.5. And, it's still there, but boy, is it ever easy to live with compared to,
what you had to go
I
through.
couldn't.
Definitely. And so,
yeah, it made a huge difference. And that's what fed me, because it's maintained. That has continued since.
So you
years.
self-taught yourself on to recognizing the addiction, and that
Yes.
then drove you into working as an addiction specialist. So it was the food addiction that made you become a food addiction specialist.
No. I was already. I got into addiction medicine. I was really interested in it anyway. After I was in family medicine and HIV care. I live in like an urban center in Toronto, downtown, like basically right near the heart of the gay ghetto, which at that time was a ghetto. I did HIV care. And then when that kind of resolved itself with the new medication, I was looking for something else. I didn't want to do straight up family medicine. It's a hard work. So I thought, I like addiction medicine. I know addiction. I grew up with, in an alcoholic family. I have my own taste of what it is. So, but then when I got into the addiction medicine and learned the concepts, that's when, and then I wouldn't have read Nora Volkow other than, it was part of my sort of required reading, weekend reading. You have to keep up with stuff. So it was because of my addiction that I discovered it. But then I discovered that even though she thought it was an important issue, and so did I, it still, even to this day, even to today, continues to be something that we just can't crack the heads of the medical industry to really get this.
And look, I hope they will. Hopefully not too long from now. And now I understand your passion.
Yes.
So someone who's gone through the difficulty you have, obviously is passionate to help other people, which is fantastic. And thank you for doing that.
Yeah, and sure. Well, thank you. It's very good for me because it reinforces for me, because I still live, even in Toronto, Canada. Even with my preaching everywhere I can, people will still go, Vera, what are you doing? Are you still following that diet? Like, come on. And we're social creatures. And if I live in an environment where I'm going to question because people are questioning, I'm going to start questioning, even though I'm fervent in this belief. If I hear enough questions, there's going to be a part of me that says, well, maybe they're right. Maybe I am too extreme. And when I speak like with you and I speak with other people and I see the effects, because of the fact that I'm speaking with you, your audience, my hope is that will make some change. That's reinforcing for me and my belief. And so, yeah, it's just as important for me as it is for the listener.
And in your practice, and this is one of my main struggles. So when I began working in high weight obesity management, you come across so many phenotypes, so many different types of patients. And so the big struggle I had was, how do you recognize a food addict?
Yeah, it's very difficult. And, I do want to commend you, because you're coming, especially, now this is ridiculous, because the study of obesity and treating obese patients, you would think that a clinician in this field would be extra interested in what is it that I give advice and the person doesn't follow it. Like, what is it? Could there be something that, Vera's meaning? But for some reason, the bariatric community are particularly loath to acknowledge this. Maybe because they would prefer to do the medications and surgery. I don't know. I'm not against those things, but it's almost like, even like with a keto diet or something, I'm not personally a pure keto, but I appreciate the value of it because it's a food addiction diet. And my perspective doesn't argue anybody. It's a compliment. Mm-hmm. If you're having a problem with whatever perspective you have, it could be that you're missing a piece. So your question, so anyway, I'm venting a little bit, because there you are. Thank you for being interested. You're unusual in that you're willing to listen.
It is frustrating because the medical field doesn't follow through, and the food industry doesn't help. And there's there is a subgroup of patients that are food addicts. And as soon as you question it, the
Yes.
immediate answer is
It's obvious, isn't
it's
it?
a groundbreaking moment for them. They say yes, and from then on, it ignites
Yes.
an
Yeah.
improvement.
Yeah. Yeah, so I mean, how do you know? That's probably the bane of all people in the food addiction world, whether they're researchers or clinicians or even patients. Is how do you know? It's hard to know. I mean, we know that we're struggling with our food, that we can't listen to the advice. We know the advice. Like, if I go to you as doctor and you tell me you shouldn't eat this stuff, I'm going to say I know I shouldn't, but I can't help
Yeah.
myself. I don't know why. Uh, so we know, but what is it that stops some people and not others? There's a disorder. There is a disorder of something happening, and the disorder doesn't necessarily mean that you're a food addict. Like there are, like you said, various types. And in my book, I actually categorize it. It's not just me, but I sort of synthesize the information, into people who are eating. Overeating just because of the food industry, which is so addictive making. It makes food highly addictive. And anybody who says, oh, you should have a little bit of sugar, what's the problem, will admit that when they have, one cookie, they want the whole row of cookies, or they, one chip, they want the whole bag. It's normal because the food industry has made stuff very addictive, craving highly palatable foods. But that doesn't mean the person's a food addict. They're just eating addictive foods. A food addict will certainly start that way, but they will eventually become addicted even to healthy foods, even to just the concept of eating itself. Like it morphs and develops and expands. So there's a disorder of something. Starting usually with the food industry, or like somebody like myself who's got a bit of I think a predisposition already, but you don't have to. And then there's the other one that is recognized in the DSM-5 or the ICD, or I'm not sure what Australia uses.
The
what
DSM-5.
do you use? The DSM. Yes. Okay. Good. Eating disorders like bulimia, like I said, bulimia, binge eating disorder, even anorexia, and there's where the problem is. Okay, you have the person and they're saying, it's not just that I eat the wrong foods and eat a bit too much. I actually eat the whole, like I did, the whole night. It dominates my mental neighborhood, so that I can't do anything other than think about food. Or I can do stuff, but it's through the weeds of this. It's like I got to move it away so I can get into, there I am listening to you talk, and really what I'm doing is thinking about what I can eat later. Like that kind of mindset is not normal, and it's not thanks to the food industry. There's something else going on. And so could it be that it's an eating disorder? And when a person is like that, they're going to look like they have a binge eating disorder or bulimia, but they might not be. They might be a food addict. And how to distinguish is where, like I said, it's the bane of existence because they look the same, and you have to dig deeper. And so we're developing tools in the food addiction world. One of them, a clinical tool that's actually been peer approved, and it's basically used primarily in research and
the Yale addiction.
Yes, the Yale. Yep, the Yale Food Inventory, a scale by Ashley Gearhart and company. But the problem with that, and it's good, but the problem with that is it's very non-specific. A person with eating disorder can also score very highly on that. It's very sensitive. It'll catch that problem. That's not just the person who's eating too much junk food, and because that makes, but they're otherwise normal. But it's not specific. How can I tell the difference between a food addict and an eating disorder? That's very difficult. And also, the Yale food inventory scale is not very easy to do.
It's not practical
at
all. It is complicated to use.
No, it's not
and the clinician,
yeah. So
it takes a lot of time for the clinician to complete it as well.
It does. So we instead modify basically the substance use disorder criteria, the criteria of what is an addiction. And there's different tools. There's something called the UNCOPE. I forget what that stands for at this very moment, but it's using the criteria. There's a few of them out there that I can give you some examples of questions, and they're a little easier to get because you only have to pass on a few of them. Are you obsessed about your food? These are all part of the DSM criteria. Are you obsessed about your food, drinks, cigarettes, whatever it is? Are you obsessed? Do you highly crave? You will choose this over something else. Even you'll eat it even though you know you shouldn't. Like it's got high palatability, high value to you, to the point where you'll choose other things. So that's one, obsession, craving. And then other questions will be, do you feel guilty about the way you eat? Are you ashamed about the way you eat? Do you eat differently by yourself versus in public? Do you lie about your food? I don't eat this stuff. And then meanwhile, as soon as you're home and you've had the perfect little salad out there, but when you get home, you pull out the ice cream tub and you're...
But so...
Exactly. And you don't even realize you're doing it, because it's almost like you have a blinder to yourself. We call that denial. So that's, and then there's can you control your amount, or can you not control your amount? So you say, okay, I know I won't just have one cookie, but I'm just going to have the top row of the box of the bag. But then you find that no, you eat the whole bag, and you keep saying, I don't know, I can't control that. That lack of control is not because of the food industry alone. There's something going on with you. And then I guess the sort of final one is, and you can't stop. You finally say, I want to stop. And then the final one is, are you eating even though it's dangerous, even though there's impairment? You've got type 2 diabetes, or your doctor says you're pre-diabetic, you got to stop. And you say, yes, I know I got to stop, but you can't stop. So you're moving into impairment. Do you cancel things? Like, I'm supposed to go out tonight and I decide I'd rather stay home and watch TV with my food. Like I'm going to buy a whole bunch of stuff, and that's going to be my event for the night rather than going out. If you do that enough, that's called impairment. So if you fulfill a lot of those criteria, that's beginning to sound like addiction, even more than a binge eating disorder, although it looks the same. But can I just say one more thing, because I've gone on about this question, but the important difference, and how are you going to know? You won't really know at the outset because the patient is new to you and you're asking questions, but maybe you can get a feel, because usually a person intuitively knows. Like you said, the penny drops when you talk to the patient. It's usually that, remember I said there were times when I stopped and I felt better. And then when I had a little bit, because I thought I'm being over dramatic, I should just have a little bit, then I couldn't continue. So a person with an eating disorder, they use food to manage their mood, but the food itself, once their mood is okay, that's the theory. Once there's trauma and their psychic distress is resolved, whether they have a little bit of food or not, it doesn't matter, because the food was just the venue to manage their mood. The food addict, it doesn't matter if they're happy, they're sad, they're at trauma, they're not in trauma. Their food is quiet if they're not eating it, unless the mood can be a trigger, but it can be quiet. And then it doesn't matter how happy they are. If they have a little bit, if I just have a little a cookie from that thing, even though I'm no more trauma, no more whatever, I'm not depressed, I'm not whatever, I'm going to finish that. I'm going to want. As soon as I bite it, I'm going to want it. And that's why they say one bite is too many. One bite is too many, just like one drink for the alcoholic is too many. So there's something about the food itself, not about the food industry. It's my relationship to the food, which is a brain thing. And of course, that's where we talk about the addictive dynamic.
Think that last thing you mentioned is what clicked and helped me recognize who's who. So clearly, that society has become an overeating society. We celebrate through food, we soothe through food, and that starts from the moment we get breastfed, because it's a dopamine serotonin surge. So most people end up soothing emotions through food, and we're all overeaters. So those that are binge eating, those that have an eating disorder, they've got soothing from food, but the addiction is the person that chemically is attached to it, and so as soon as there's a trigger, they're off.
Perfect. I love that. It's the chemical attachment. And if you didn't put it in your mouth, you wouldn't have the attachment. So if I don't put it in my mouth, I can certainly remember, and I could certainly think, just like I don't drink anymore, I could think, it was really nice to be drunk once in a while. And I could think that and then pick up a drink. But it's not like, oh my God, I've got to have it, because the only way that this feeling will go away is if I give into it. It's that feeling like, it's like an itch that you can't scratch, that chemical reaction to the food. It's like an itch. And I often say, with when you have an allergy, it's a histamine reaction. So you're scratching, and of course it's making it worse because you're releasing more histamine in the skin, and that's itchy. So, but when you eat something, it's like a histamine reaction, but it's a dopamine reaction in the brain. It's like it spurs off the dopamine, and dopamine is that feeling of want and anticipation. And so I've just made it worse by having a little bit. Now I want it even more. I didn't want it, but now I have this. I wanted it a little bit, have something, and now I want it even more.
And so to make things even worse, things overlap. So someone can start as an overeater, then become bulimic,
Yes.
and then in the background have binge eating.
Yes.
So by the time they come and see you, it is confusing.
Yes. Absolutely. And that's why it's even harder to distinguish between those three categories, because you can be, you started off as just a comfort eater, overeater, and then you've morphed into becoming a food addict, or you can even be a bulimic and now a food addict as well.
And so sometimes the academic diagnosis is not that relevant, because the treatment ultimately is going to be the same, and we'll get to that.
Yes.
But I would like to share the statistics that you wrote in your book, and your book's fantastic for those who haven't read it. So you said that based on your clinical experience, as much as 50% of the obese are food addicts, 10% of the overweight, and 10% of the overweight, and 20 to 30% of the 20 to 30% of the overweight, and 10% of the normal. And so there is a lot of this happening.
Yes. A lot of this. And interestingly, I don't know if you're going to pick it up, but there's actually more food addiction in the underweight than there are in the normal weight. Because they could be restricting their food, but still thinking it, because it's not this is an important thing when we talk about, like the weight will give you the concept of the statistics, but when we talk about food addiction and treatment, we really emphasize this is not about weight. This is not a weight loss thing. The weight loss will be a consequence, and it will be a welcome consequence. It'll be the reason why you enter treatment, but it should not be the motivator, because it never works.
True.
It never works.
And that's how weight management should be managed as well, aiming towards health improvement rather than weight. And we're shifting it towards that, thank God.
Oh, good.
The next question is, it doesn't matter when you diagnose a food addict. I know that there's stages, and so is it true that the first abstinence is the most successful?
Yes, I think that it matters, but you're really lucky to get somebody early stage. You see, what happens is it's like any other addiction. It's a gradual, it's almost like there's a dopamine impairment that begins. First of all, it's a dopamine adaptation. It's like an downregulation of dopamine receptors. Like it's a normal thing. When you're living in an environment of too much, the brain is going to withdraw by trying to make the too much normal. And that's the beginning of addiction. It's actually an adaptive approach, which is good. But what happens is if you continually stay in that environment, that adaptation becomes its own disease, just like anything else. And so if you can stop right at the beginning, it's like if you get a person when they're pre-diabetic and get them to eat well and whatnot, then there's not too much damage, and it's providing they don't continue and return back into that environment, they're going to have normal sugars, and their insulin will be back to being non-resistant. It's all going to be fine, and they might even be able to get away with a little bit here and there, like basically the concept of moderation. So, I mean, my grandparents also were predisposed to any kind of addiction, but they weren't food addicts because they didn't have the exposure. And so that a little bit here and there, like their food addiction, because lack of access and lack of encouragement, did not expand. And so they went to something else like alcohol or smoking cigarettes or maybe nothing. But anyway, they might have been at the beginning stages, but they could moderate here and there. They were okay. So they had a little bit of cake. Like, believe it or not, we would have cake once a month, like just on a birthday, at Christmas.
Life used to be more frugal, but now it's just there's too much.
Absolutely. Yeah. And especially with sugar. So if you can catch somebody early on, then I would say, well, first of all, you're going to protect yourself from getting all sorts of metabolic disorders at a ridiculously young age, but also you're going to protect yourself from getting, in this overwhelmed environment where addiction is actually a response, a brain response, normal brain response, unfortunately not normal in the end. Before that develops, then you can actually live in a world where you might be able to have a little bit of cake once in a while. Once once things have adapted so much and changed, it's like it becomes fused and brittle, and there is no more flexibility. And so somebody who's an actual addict can no longer have a drink if they're an alcoholic, because it'll spur off the problem. The diabetic cannot have sugar because their sugars are going to go back up to 20 or something. Like, it just happens. It doesn't happen to a normal person, but it does to them. And similarly with addiction, it'll eventually be such that you can't have a little bit. You can't even moderate a bit.
There is a group of physicians that suggest that through neuroplasticity and moderation, you can retrain your wires. How true is it? Because with addiction, that doesn't work that way, right?
I'm not a believer of that. So I know that there are tools, and when I hear that kind of language, it's more, I think, maybe you can tell me differently, that it's in the context of mindfulness and meditation and all that kind of stuff. And I would say if you're living in a normal environment, that's probably true. Because, we learn to be afraid, and then we learn not to be afraid, and you can re-expose and do exposure therapy, whatever. You can kind of, but when you're living in an environment that is so extreme, like, we have to realize that the food industry, the processed food, is not really food. It's toxic, and it's created, this is my belief anyway, not just mine, but I'm coming from that position, that it's so toxic that there is no moderation possible. Sure, there's moderation in a country where there's no war. You can, occasionally people have fights, and so what? But when it's so trigger happy, that's a good word, that anything can blow up. There's no moderation, and I don't believe fusing. It's basically, here we go. It's like asking somebody who has post-traumatic stress, can you rewire and not be afraid when you hear the noise that sounds like a bomb to you. Maybe they will by the time they're 80 years old and they've lived in an environment that's so quiet, or they've figured out. It's tremendous. It's extremely difficult to undo extreme response like post-traumatic stress. And I would like to suggest that we see addiction in that same category. It's in a beyond repairable response. We're basically learning to manage a chronic progressive condition.
Those are wise words. And what is the success rate of recovery?
Well, okay. The success rate of recovery in general addiction, including food addiction, is, if I wanted to give a flat out statement, in the 2022-23 time period, is probably about 10%, something like that. And by the way, for those people who are listening, that's actually not that different than any medical intervention. There's a lot of medical interventions that just like high blood pressure and diabetes and whatnot. And the problem is not the fact that the therapy isn't good. It's basically patient compliance. The people don't want to do it. They don't want to take the meds. They don't want to do the therapy. They don't want to do whatever it is. And with us, they don't want to stop the sugar. Why? Because it's addictive. It's the whole problem. So patient compliance is a real problem. So if they've addressed their external environment, basically, if they've done everything that we said, which is not just quit sugar, it's okay, because that's just the diet. Quitting sugar is just the diet. And it only lasts for a while, and then the cravings and the thoughts come back. You have to adopt an addictive mindset, which means, what are my triggers that are going to make me think I can have sugar when I'm having a bad night and I'm on my own? Well, my triggers are that there's something in the fridge, that somebody's called and said, hey, let's make such and such. Can I address all those triggers so that when I'm having the bad night, there's nothing. I'm not even going to think about picking up something because it's not in my mind. And so therefore I've used an alternative tool. But if it's there, I'm going to think about it. So you have to. So if a person does all of the tools, and support is a huge one. Remember, I was saying we're social creatures. If you do all of that stuff, that means you're willing to potentially see a life like a coach, a food coach, or a counselor. You're willing to do a 12-step program. Alternatively, you're willing to do an inpatient treatment. Like you're willing to do all that stuff. Then the success rate is very high. But getting people willing is not that great. And I would say that I don't have statistics to give you the success rate because we don't have treatment. We don't have research on treatment. We're only building. Right now, we're at the era, in the 2020s, of actually building treatment, training clinicians. And so I suspect that we're going to have more treatment research in the next 10 years that can actually give us numbers. So I can only give you my own intuitive or personal clinical experiences that if a person actually does everything, follows all the advice, it's probably closer to 70%. Yeah. That's the case with everything. You know, it's the case with everything. And can I just say, I really want to say this, if I don't get a chance later, that there are a lot of people in the food addiction world who have done everything they're supposed to do. And it is possible that they've lost a lot of weight, like 100 pounds, sometimes more than that. They've maintained that. This isn't like a yo-yo thing. They've maintained it with peace. But it's come at the cost of no sugar, no flour, maybe no grains, maybe no something or other, whatever their triggers are. But if you're not eating it, you're not deprived. It's just not part of your world anymore. You found pleasure in something else. I never thought I would enjoy Brussels sprouts as much as I do now. Like when I was eating cheesecake, I'd get Brussels sprouts. Why would I want that? I love them.
Your taste buds adapt. So people will notice this, and we'll talk to this at the end. But taste buds end up recognizing more flavor once you're off processed food, and that definitely does
absolutely.
Happen. So for the patients, for the practical management, the first step for a patient would be you go and see someone. That someone will help you recognize your triggers, and from then on, you start practicing abstinence, like any other addiction. So
yes, exactly. And I'll say that the first thing is most likely going to be sugar,
flour, fat.
Yeah.
So anything that's boxed and bagged, essentially.
Yes, exactly. Yeah, anything processed is a good clue right there.
Any tips on, because most patients come in, they recognize the illness, and then they struggle with giving away what they've always been attached towards. So any tips for those who are undecided in giving it up?
Oh, undecided. The undecided is they're harder than the ones who've decided, because the ones who've decided, the good news is, with any addiction, I'm going to answer that question first. Once you've decided to quit, any addiction has a withdrawal process, and the withdrawal is, I really want this thing. How am I going to sleep tonight without having my whatever it is that I got to have that bottle of wine, or I won't sleep. I've got to have that big food buffet that I have every night, or I won't be able to sleep. That kind of anxiety and insomnia and all that sort of stuff, it's normal. I mean, just knowing that you're going to go through it and that it's normal is very helpful, but also that it's very time limited. It only lasts about 10 days. I mean, yes, it's long, 10 days. It's 10 days of hell, but it ends. And then you're actually, oh my God, thank God it's over. So the best place to be is to make the decision to stop. And for those people who are waffling in between, I would say, this is why we do a lot of sugar-free challenges, like for a month or 3 weeks, or maybe even 2 weeks, but 3 or 4 weeks is better. Just try it for a month. You can always go back. But if you can get over the hump, then you'll know that if it's worthwhile or not. So I guess it's much easier once you've made the decision. It's just like, okay, think about the person who hasn't decided and they're wondering if they should quit smoking or not. So they quit smoking, that's 2 or 3 days of, oh, geez, I don't feel good. No, I'm just going to have a little, you're having a cigarette. Let me just have a puff of yours. And then you feel a bit better. So now you're going to have 1 or 2. And so what you're essentially doing is prolonging the agony. of the withdrawal. What would be 10 days, you've now made 20 days, 30 days. Like people who do the patch and the vaping, they're just extending the agony of that withdrawal. And so then they're going to say, oh my God, it's horrible when I quit because it's never ending. Well, it is never ending because you haven't made that decision to stop. So the first thing I'd say to the person who's undecided is wait until you're ready. because it's and try other options first. Become convinced that, like, usually by the time people, they always say in addiction, it's the last, you were the last office on the block, the last treatment center on the block. You're the last thing I was going to do. Who wants to quit sugar? I'm only willing to do it because I've tried everything else. And then, excuse me, and then you'll be in a better state. So if you can wait until you're convinced, and then in the meantime, read as much as you can. Really, we want to shift that view that sugar is not a norm. It's not love. It's not social. It's all of those things disguised because it's really a toxin. It's a drug. And it's the same as, if I go and visit somebody and I can't enjoy myself without a glass of wine, there's something wrong with that picture. So let's get rid of the wine and enjoy the person. So educate yourself. But, okay, I that would be my first approach. Wait and educate yourself. But if you're saying I can't wait because I'm pre-diabetic and I just can't wait, then I would say at least start with the big hitters like pop, soda, stuff like that. And if you can, stop with the really obvious like floury products like
cakes
pizza,
and breads.
As much as stop with the condiments. Yeah, exactly. And the condiments, there's so much waste with you've got a wonderful salad and then you pour in the salad dressing and you've just blown it. So start with the obvious stuff. And maybe if you're not that bad, you can get away with that. But it's what we call doing the research. You have to find out for yourself.
So one is Vera's Vera's book is fantastic, and it will be attached in my notes. And also Dopamine Nation, which is another very good book on addiction and how dopamine and the neurophysiology on how addiction works. That's an eye-opener for people that have an attachment.
Yes. I like that. And Robert Lustig's book, Fat Chance, and he's got a few books now. He just wrote another one a couple of years ago. Robert Lustig, who talks, a lot about the actual medicine, the negative physical consequences, like diabetes and metabolic disorder. His latest book was called Metabolical. Did that get over to Australia? Oh, it's a must read. Well, if nothing else, go on YouTube. He has his famous "Sugar the Bitter Truth" video that's viral. Like, it's one of them out of the whole food addiction world. It is the video that everybody must see. So it's a must see, and it's free. It's called Sugar the Bitter Truth.
I'll get the
Robert Lustig, and he talks about the medicine. Yeah, but he talks about it in a way that you don't have to be a doctor or a physician to understand. I mean, yes, that helps, but you don't have to be. I mean, it wouldn't go viral.
He simplifies it. Now, in relation to the treatments available, you mentioned the 12-step process, and so abstinence is the way to go, I think. But so is there a benefit in psychological treatment? So is a patient better off doing the abstinence in association to psychology therapy?
Yes. Okay. Can I just back up? I forgot one more thing. Although I'm not a fan of sweeteners, I'm talking about abstinence. So sweetener is not really abstinent because it's still the sweet taste, so there's still the dopamine surge. However, it is better than sugar. So if we're thinking about the addiction world, there's something called harm reduction. So it is a harm reduction maneuver. It's like vaping instead of smoking cigarettes. Well, it's not as bad. So if the person wants to just put their feet in and try sweeteners. And it's not a good endpoint, but it is a bridge. And I know a lot of people who are willing to try to quit sugar if they can have sweeteners. So folks, if you're listening, go for that. Try that first. I actually did it for 4 years. I used sweeteners. And then
especially if their addiction is in the late phase and it's quite embedded.
Yes,
No, exactly.
yes, then it's not a good thing. But uh, but it's still better than sugar. So really, if it gets you off the couch
Do it.
and willing to do it, do it. Um,
The
okay,
question,
and then sorry,
I love
that
your
got me
passion.
all
The
excited, and
question
I forgot
is
your question.
about psychology treatments. Are they a must? Do patients benefit
Yes,
from it in
yes,
attachment to the abstinence?
yes. Yes, they do. Psychology treatment is a must in any kind of addiction because what got you into the problem was probably you used your addiction as a way to deal with psychology. But there's a caveat here that's really important. You still have to put down your food first. The thing that I say is the most important is that chemical reaction that you're talking about, which means abstinence. And then once the person has stopped, how do they stay stopped? There's where the psychology comes in because I have no food to help me deal with all those issues that I haven't been dealing with because I've been using my drug of choice, which was sugar or food. So now I need tools instead of food that I can stay off of the food because I've got those tools. And I'm going to give you an example here. When we had our food addiction program at Renaissance, it was a joke amongst not exactly a joke. It was like a sort of wry humor joke amongst the staff, where we would say it was the food addicts that were the most difficult to work with because everybody came in because they were with all of everybody else, the alcoholics and the cocaine addicts. So the cocaine addict, no cocaine obviously is allowed, no alcohol is allowed, no opiates are allowed, and they're all in withdrawal, but they still had food to reach to. The food addict, they're not allowed the alcohol or the cocaine or the tobacco or the whatever it is. They had nothing because the other people are eating the food, the sugar, but they're not allowed to. So they had nothing. So they were like raw. Yeah, and they were like raw going, what do I do? And that was a great trouble for the staff who weren't used to that because they were used to be able to say, just have, they would, give people snacks at night at 10 at night, big cakes and whatever. And the food addicts were like going, I can't sleep. What do I do? So you need therapy to
And
now
out
live
of the
life without
therapy,
that substance.
which is your preference? So
Yes.
is it a mix of cognitive behavioral therapy or acceptance commitment therapy or even dialectical behavior therapy? It doesn't matter. It's
Oh, perfect. If it's affordable, dialectical behavioral therapy that is the best type of therapy, I think, in just any kind of addiction because it covers all angles. It covers self-soothing. It covers cognitive restructuring. I love that one the best. But one thing that's really important because those things are expensive and I think that what's even more important is the therapeutic alliance with the coach or the whatever. It's the support. That is the most important thing because often people are eating because they're filling a hole. It's almost like a maternal hole, and they have, like I said, not learned how to cope with that. And just having social support, like I would love to see more food addiction programs inpatient, especially for end-stage food addicts, so that they can be like we do with our addicts in general, and in this bubble of support, so that they're raw, but it's not so bad when you're not the only one. And it's not so bad when you're getting a lot of affirmation and support along with the tools. So I would say abstinence first, support second, and then therapy. And I like dialectical behavior the best. Cognitive is good, but it's not enough.
Restructure your thought process. My dream is to develop a therapy that starts with abstinence, potentially inpatient, outpatient management, and then DBT. And so go strong on DBT, which I think is probably a life changer.
Yes. And notice I didn't say in there medication. Medication is helpful, but I don't think it's. I think these other things are more essential.
Things like semaglutide, Ozempic, and Saxenda, and patients end up plateauing. And as soon as they start reintroducing the sugars and the triggers, they need higher levels of medication, and they start noticing it.
Yes.
So it's not the solution.
Exactly. Yes. It's not the solution. And just like bariatric surgery, it's not the solution. It's a good start. I always say to people that if you want to get some of the positive effects really quickly, but you're going to lose all the benefits if you reintroduce the food, which people will, because they're addicts.
And with
a lot of them.
so the
Not
other
everybody.
issue with addiction medicine, which happens with food addiction, is there is the tendency for addicts to change over to a different addiction, and the power of substitution. That's quite daunting. So
Yes.
the food addict that starts their
Yes.
journey, how can they address this and avoid going to a different addiction?
That is one of the reasons why I would say that this is not just about quitting the substance. There's a whole program that has to be involved, a whole addiction program. And that addiction program then says, I have this want, this insatiable desire for something to make me feel better. And if you don't have a program that addresses that, you will just look for something else. And that something else will be shopping or internet or sex. There's so many invitations to find something else, and that's why I don't think I think it's almost like if a person tries to do this themselves just by quitting. This is why people get worse with diets. They're starting the process alone, or maybe with other people that are doing the same thing, but they don't have any understanding about addiction, and then they're just opening themselves up to reintroduce, and they don't have this. They don't have the tools and the support. You need to have the support and whatnot, so that you would then say, you know what, I think I might be. I'm feeling better here, but I notice now that I'm paying much more attention to Google shopping, and there's a problem there. So then you could say, okay, what are the tools? What's happening? I'm still looking for something. That dopamine is still, it's like a hungry dog that's sniffing it somewhere else. And I recognize, okay, that's the addiction, untreated. So what do we do about that? And so that would be where dialectical behavioral therapy kicks in. But you're not going to recognize that yourself, because when you're in that state of mind, your frontal lobe, your cognitive rational thinking is hijacked. It's been derailed by this animal within that just wants.
It doesn't respond to moderation.
Exactly. Yeah, exactly. Or to reason and rationality.
And
that's
for those,
why you need help.
Again, the other group that I struggle with, one, kids. Because I've seen food addiction in kids, and the social exposure is too difficult to address. So, any tips?
I know. I can only or sympathize with you or commiserate with you. I really worry about our children, because we're in an environment that is just it's like we're hitting the vulnerable, and I don't know what to say about that. It's like, what do we do with kids who are are in the schoolyard, and there's marijuana and there's cigarettes, and usually what we say is we remove them from there, or what we do is we try. Well, first of all, the parents have to be on board, and they can't do things like, well, the kid wants this, let them decide. We wouldn't let them decide to pick up a cigar and start smoking. Why are we letting them decide that they should have their Halloween bag? Like, why are we letting them decide? We can say it's too immature. So a lot of it is parent job to restrict access, not let kids decide on things that are dangerous. And then, but again, this is more the parent thing. Can the parent support an alternative mindset that is a norm, even though it might be, like one of the things we used to say for people so that they didn't start smoking marijuana and stuff is get them involved in sports, because the sports mentality is, my body is a temple. I don't want to do drugs because it's going to ruin my physique that I'm trying to build and my mental status that I'm trying to build. So if we can get some kind of alternative, but what is there out there right now for kids to say, yeah, but everybody's eating this stuff and it's exciting, to have some alternative that looks good, not bad. I don't want to do this because it's bad, but I want to do this because it's better.
And legislation driven, because it's too socially acceptable, sugar and processed food, unfortunately.
It's exactly, yeah. Yeah, and you know yourself, like how long does it have to be when with exposure to processed food where you
Yeah,
start to see metabolic changes in
it
kids?
is sad.
It must be
And
really
what about those
discouraging.
suffering with ADHD?
Yeah.
So again, they tend to be more impulsive. They have a tendency towards addiction. Um,
Yes.
do they need to address the ADHD
Yes.
before endeavoring into a food addiction journey?
Well, that would be the same as asking that other question, or I don't know if you asked it so explicitly, but a lot of people will say, I have to deal with my issues before I can change my food and eating. And I actually think that I quit the sugar first
Uh-huh.
and then see what the ADHD actually translates to. Because I don't want to say that sugar causes ADHD, although I know some people will say that, but it certainly exacerbates it. And so you don't really know what you're treating. And the same with medication and drugs. We have a sort of rule of thumb in the addiction world that unless the person's going to go out and kill themselves, like with an opiate overdose or something, where we just give them anything to keep them in the treatment center. That's not quite true, but that kind of way of thinking. If the person can tolerate to wait 2 or 3 months until the drug substance has left, and then we know what we're working with.
Try with a good social with a good
Yeah,
support network.
So yes, yes. And then see if the ADHD actually does need treating after the fact. Like, because again, remember, once a person has stopped, who are they now? What tools do they need so that they don't return? And so it may be that they need medication so that they don't return. But you're not really going to know that while you're in the thick of what is causing what.
Tell us about your food addiction course. So you've got 2 or 3 going.
Yes.
You've got one with Dr. Westband that it's actually it's not taking any more patients, but there's also one with Sandra Elia that I've interviewed earlier. What is available out there for patients to enroll?
Well, for what I'm doing, there's the Dr. Westman, which is the Adapt Your Life program, and we've done 2 runs of that. It's sort of like a month-long program, and the next one will be in next spring, and it's called Sugar and Food Addiction, and it's a video course that is $167 US. That is 13 videos plus support, and it's actually Facebook support, but like when it's actually running. So it's timed at a particular time so that we can offer that support. It's quite possible, though, not in the new year, but after the next one, that we'll offer it all the time without the support. That's a possibility. Yeah, so that's one course, and I'll let you know when that happens. I'm in the process of doing another course for clinicians, but that's in the works right now. Sandra Elia has a sort of a food addiction academy that she's starting up, and I'm one of the people with that. Any of that kind of information you can find on my Facebook page, certainly the Facebook page, and also my website, because I document all that on there. But if you want to get started and learn stuff, I've got a YouTube channel with ton of videos, and you can.
And so, what's the name
check
of the
that out as
YouTube
well.
videos? Is it Food Junkies? Vera Tarman.
Yeah, it's just Vera Tarman. Just Vera Tarman. Vera Tarman YouTube, and then you'll find my channel. And my my web page is called addictionsunplugged.com, and it has a second name, but it's the same page called veratarmanmd.com. And then my my Facebook group, which I'm very active on, is called I'm Sweet Enough, Sugar Free for Life. And it's free, and I have all the clinicians that I work with, PDF of them. If you need to get a coach, it's across the world. They often have free groups that are listed like Zoom groups, and when there's one for every day of the week. So if a person wants something on a Monday, and they're like we're talking now, it's 6:00 my time. They're often like later in the day, so they're somehow workable. Some are in the morning. somebody
Yeah.
from Israel, so whatever Israeli time is. So anyway, something free every day so that a person can jump on. Because remember, we need that
That's what
support,
people
and
need.
that's
They
where you
need
get lots of
around the clock
information
support.
as
And
well.
hopefully this country will get something similar to what you do.
Yes.
Look, that's been fantastic. Thank you for the
Yes.
interview. It's been an absolute pleasure.
Yeah, and thank you for your interest. I really commend you that you're actually wanting to embrace and
Thank you,
include
Vera, and we'll
this
talk soon.
information in your
And for
practice.
those who are interested, please read her book. It will be
Okay,
on my program notes. Bye.